So let's start. If we consider a cardiac myocyte at its resting potential, we'll see that it has negative charges on its inside and positive on its outside. So if we connect a voltmeter to this very cardiac myocyte with both its electrode outside the cardiac myocyte, we'll get zero potential. This is because there is no current flow across the membrane, and so the voltage is zero. So now an electric impulse reaches this cardiac myocyte and there is exchange of ion across membrane. This leads to the appearance of negative charges on some part of the cardiac myocyte, whereas the rest remains positive. This difference in charges causes voltage, and so current flows in direction directed from negative to positive. Since both the electrodes lying outside the membrane have their axis along the same direction, so a positive deflection will be. So if the same thing happens but in opposite direction, that is current flows from the other end of the cardiac myocyte to this proximal end, this will be recorded as a negative voltage on the voltmeter within the ECG machine. If we consider the cross section of heart, it will look somewhat like this with its four chambers, right and left atria and both the ventricles. It has a conduction system, as we all know: SA node, AV node, a bundle of His, and finally the Purkinje fibers. The SA node fires the electric impulse, and that electric impulse depolarizes both the atria before depolarizing the ventricles. So now when the ventricles depolarize, the ventricular mass becomes positive with respect to the resting atrial muscle mass, and so the apex of the heart becomes positive, whereas the base is negative. Now the direction of current is thus from base to the apex. Since for a most part of the cardiac cycle the ventricles, which have a greater mass, remain positive, so the entire cardiac axis is from base to the apex. The electrical activity of the heart generates vector which changes its direction throughout the cardiac cycle. The summed up vector is known as the cardiac axis. So now if electrodes are placed at different points, the same cardiac axis is recorded differently in these different electrodes. Let's place a positive and negative electrode. The axis of this electrode is along the axis, the cardiac axis, and so a positive deflection will be recorded. Now electrodes are placed at a different location, and their axis is along the cardiac axis and very similar to it in sense of direction. Therefore, the voltage generated in the ECG will be of higher voltage than the previous. Change their direction, as in positive attached at the upper end and negative at the lower end. Their axis becomes opposite to that of the cardiac axis, and so the deflection on the ECG is downward, which means a negative deflection. So there are two leads in ECG, lead 2 and lead AVR. These two leads are exactly opposite to each other. Lead 2 is exactly along the cardiac axis, and lead AVR is exactly opposite to the cardiac axis. Therefore, when ECG is recorded, The ECG changes are positive in lead 2 and negative in lead AVR. So we'll get a positive P wave, QRS, and T wave in lead 2, whereas all these will be negative in lead AVR. An ECG has a total of 10 electrodes but 12 leads. The 10 electrodes comprise of 4 limb electrodes and 6 chest electrodes, whereas 12 leads have 6 chest leads and 6 limb leads. The limb leads are color coded and attached to each of the limb. The 6 chest leads are arranged on the precordium in this manner. The black electrode is neutral, whereas the rest of the 3 electrodes switch their polarity and give us lead 1, 2, and 3. These are simple limb leads. For instance, we get lead 1 when the ECG machine makes the right arm negative and the left arm positive. These 2 electrodes give us an axis which is known as lead 1. So the chest leads are obtained when any of the chest electrodes, say V1, becomes positive and the 3 limbs become a single indifferent or negative electrode. With the same 4 limb leads, we also get 3 augmented limb leads, AVR, AVF, and AVL. A single augmented limb lead is obtained when 2 out of the 3 limbs become a single negative electrode and the third limb acts as a positive electrode.